Okay, so a lot of times in the hospital, this is how braces are applied. And we're just trying to make the situation better by illustrating this here. Posterior panel of the brace of the TLSO is going around the patient, okay? Okay, we just saw, I haven't even tightened it up yet. Yeah, yeah. We just saw how it was not in the patient's neck when they stood. Now we're trying to get it around them in this relaxed posture, which many patients will be because they're more tired in the hospital, they just had a surgery, etc. Okay, and so now we have it in the patient's neck. No good, no good, right? So we'll just go through this a little bit here. If this scenario presents itself, you can understand why they would hate their brace. It's a good thing actually that Bob can actually right himself right now so the brace is not in his throat. It's more snug in the seated posture, but if we remember from our measurements before, the circumference in his abdomen went up, just off the top of my head, 5.5 inches, I think, okay? So if a person has any tissue right here, and even if they don't, there's an opposite problem that can happen. Anyhow, if a patient has any tissue right now, when he stands, as we talked about earlier, his body will change. His body will change, and then the whole brace will be loose. So Bob, do you mind standing up here with me? Okay, so the whole brace, is loose on the patient right now. So one of the things that I recommend for our patients is to go back and try to correct the brace as much as you can, okay? This is not the ideal scenario. I think everyone watching this knows that. I'm going to come around to this other side. Okay. Okay, so it's at least better than it was. But we've gone from a seated posture to a standing posture, which is probably not good unsupported for many patients in the hospital. So we had to snug that brace up a lot when he stood because his circumferences reduced. Sometimes what happens is if someone has an abdomen, the brace is on loose, okay, or it's donned in the sitting position. They go to stand up, their abdomen can actually fall because they only have a gown on. They have no clothes to help hold anything in. Their abdomen comes down. Okay, so the brace is really loose. Then the patient actually goes to sit down again, and their legs start to kick that tissue up into the distal aspect of the brace in the front, and it'll drive the whole brace up, and it's just a really bad scenario. So you can see why applying a brace the best way possible is better for you as the medical professional, it's better for the patient, it's better for outcomes, safety, everything. So we're now going to show how an orthotist does this. I'm going to show now with you. So does this feel snug here? Does that feel snug? Okay. So now we'll lay down the patient, and this is how, at least I recommend to my patients, many orthotists do this. When a person lays down, why it's important to consider laying down your patient to actually tighten up the brace and even to apply it if they can get there. All right, so here we have another scenario in the brace world, whether it's an adolescent who's wearing a scoliosis TLSO, whether it's an adult or anybody wearing a TLSO, whether you have soft tissue or not, this can happen. When the person lays down, their circumferences in this aspect of their body reduced in size. So the point is, if you apply a brace in a standing position or in a sitting position, you probably could have made it more snug if you laid the patient down. And you can see why. It's because I can put my hand inside the brace when the patient lays down. This is how we apply TLSOs whenever we can, or at least ask the patient to at least highly consider doing it this way to finish off thinking, okay, now I have my TLSO on. My doctor told me I can sit up to start putting the brace on, I can stand up to snug it up, or if they stand up to apply it in the first place. But what we think is coming back to a supine position, snugging it down, you can just go so much further with this process. So there we go. It's usually this area that's able to be made more snug when someone lays down. This circumference might be able to benefit, but it's more so in the lower half of the TLSO.